For over 100 years, the Philippine Women's University has been known as a leader in quality education. In 1934, PWU moved into its main campus on Taft Avenue, and since the 1970s has been co-educational. Located in the heart of Metro Manila, it is easily accessible by public transport and surrounded by affordable housing. PWU School of Nursing has been offering high-quality, student-centered, and innovative nursing programs for over 6 decades. PWU's graduate programs upgrade the qualifications of nursing professionals, allowing them to advance in their chosen fields in the Philippines and globally. In the allied health fields, PWU pioneered in programs such as pharmacy, which was established in 1926 to train students who want to succeed in any aspect of pharmacy services. The first women doctors polyclinic in the Philippines was set up in PWU in 1951. In 1986, PWU's Bachelor of Science in Nutrition and Dietetics became the first nutrition program to be accredited by the Philippine Association of Colleges and Universities. PWU was also the first educational institution in the Philippines to focus on the prevention of acute illnesses and chronic diseases through its Master of Science in Clinical Nutrition program taught jointly with the St. Luke's Medical Center. PWU School of Medical Technology offers a competency-based curriculum enhanced by intensive training in clinical laboratory procedures. Offering a Bachelor of Science in Medical Technology and a Master's program in Medical Technology and Health Systems Management, PWU also offers a certificate program in phlebotomy. In nursing and the allied health fields, PWU continues to play an essential role in healthcare education, producing graduates who possess the skills that make them competitive in the country and anywhere in the world.
Good afternoon, everyone, and welcome to our webinar entitled Transforming Global Health. This is in celebration of the World Pharmacist Day and Clara Aragon Memorial Day of the School of Pharmacy. And to start this event, let us be ready for the invocation to be followed by the Philippine National Anthem and the Philippine Pharmacy Hymn.
أعوذ بالله السميع العليم من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين الرحمن الرحيم مالك يوم الدين إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين آمين.
Let's bow our heads and place ourselves in the presence of the Lord. In the name of the Father, and the Son, and the Holy Spirit. Amen. Dear Heavenly Father, we thank you for the gathering all of us today in this important event, the World Pharmacist Day. May you bestow your guidance and blessings on this event so that we can enjoy and appreciate its significance in our lives. Bless everyone present today that each may be able to share what he or she has for your glory and honor. Grant good health and safety to all of us and our loved ones, and peace and goodwill to all men. May the various activities related to this event be a success through your intervention. We ask all of this in your name. Amen. In the name of the Father, and the Son, and the Holy Spirit. Amen.
Mga kababayan, ang pambansang awit ng Pilipinas.
With voices
to our University President, Mr. Marco Alfredo Benitez, the PPHA President, Maria Hilda Sebua Salhay, to the administrators, to our guest speakers, faculty, and students, good afternoon. First of all, I would like to thank the FJC PPHA for organizing a series of events for in celebration of the World Pharmacist Day and Dr. Clara Aragon Memorial Day. Last September 23 and 24, the students had Kahoot Quiz Bee per year level to assess just how much they have learned in the first trimester of the academic year 2020-2021. And in September 25, the SOP or the School of Pharmacy launched the program we call Pabili Ka Pharma. Because the PW School of Pharmacy knows how much this pandemic has greatly affected us in our sources of income, which led most of us to resort to operating business online. The FGC PPHA promoted and advertised small online businesses of our pharmamates to help them gain customers and earn more profit. Today, the School of Pharmacy celebrates the World Pharmacist Day with the theme PhilWomenian Future Pharmacists, Catalyst in Transforming Global Health. And we are also celebrating the Dr. Clara Aragon Memorial Day, the founding dean of the School of Pharmacy. This is a webinar about transforming global health that will be discussed by our humble and competent guest speakers, which will be introduced later on. And to give us an inspirational message, let us now welcome the University President, Mr. Marco Alfredo Moya Benitez.
Sir, wala po.
Once again, the University President, Mr. Marco Alfredo Benitez.
Our distinguished speakers, President Maria Gilda Sebua Salhay, President Leonida M. Ocampo, Mr. Paul Anthony Balbero, our SPPAA, Dr. Felina Young, Program Chair Harvey Adamson, our hardworking deans and program chairs, dear faculty, students, and all of those watching on our social media pages, good afternoon. Allow me first and foremost to thank our speakers for taking the time out of their busy schedules to be with us today in this virtual event. It's true that while this scenario of working from home does have its advantages, it has also made our lives even busier to some extent. So we appreciate your time and effort. Today we cap off the week-long celebration of Pharmacy Week with a post-celebration of last Friday's World Pharmacists Day and Clara Aragon Memorial Day. I remember a year ago, September 23 to be exact, we celebrated the 2019 World Pharmacists Day at the Conrado Benitez Hall in PWU, where we honored the 2018 and 2019 board exam passers, stressed on the importance of ensuring the safety, quality, and efficacy of medicines our pharmacists will promote, and launched Pinnacle 2026, the 5-point strategic agenda of the PW School of Pharmacy, as it gears towards its centennial celebration in 2026. What a difference a year makes. Now, 7 months into this global health pandemic, the theme of today's event, PhilWomenian Future Pharmacists, Catalysts in Transforming Global Health, is timely and appropriate. With global confirmed coronavirus cases surpassing 32.7 million over the weekend and deaths approaching 1 million worldwide, many countries still continue to struggle with their public health response and are nowhere near flattening the curve. Here in the Philippines, we still average just slightly below 3,000 cases per day, with a cumulative positivity rate of 10.3%, roughly double the WHO standard. In the United States, the world's superpower, they are averaging roughly 40,000 confirmed cases daily, from a high of 70,000, and have already surpassed 200,000 deaths from coronavirus. Even in countries that responded better than most to the pandemic, pockets of surges are still unavoidable, which tells us that only the arrival of a safe and effective vaccine, distributed and administered on the majority of the world's population, will truly provide immunity to this disease. Never before have the world's best scientists and pharmaceutical companies worked at such rapid pace to develop a vaccine against COVID-19 that it looks like there will be a safe and effective vaccine by year end. Truly a world record as far as vaccine development is concerned. But even with a safe and effective vaccine on hand, without the majority of the population trusting its safety and efficacy to allow themselves to be administered with it, then all efforts to eradicate this disease by way of vaccination would be for naught. It is here where lies probably the greater challenge. With so much dissonance and politicizing around the public health measures undertaken against COVID-19, at least in the world's biggest economy, there is a significant chance that a majority of the population would not immediately subject themselves to a vaccine once it becomes available. That is why many experts estimate that it will really only be in late 2021 and even 2022 for developing countries like the Philippines when we will really be able to see ourselves going back to our normal lives. Therefore, while technological advances on the development of vaccines, therapeutics, and treatments for much of the world's major diseases have been phenomenal, ultimately it is still the public's trust in the health system, including the pharmaceutical companies, the medical professionals, scientists, doctors, and yes, even pharmacists, that will truly determine whether individuals will agree to subject themselves to these treatments. As future pharmacists, you will play a vital role in maintaining and even strengthening that trust. You may say, but not all of us will have the opportunity to be part of the development of groundbreaking vaccines or medicines to combat the world's dreaded diseases. But remember, at its most basic level, the decision whether a person will take a certain form of medication, vaccine, or treatment will still be highly dependent on the person recommending that medicine to him or her. Normally, her doctor, or sometimes, as I've seen in many drugstores, the pharmacist behind the counter. I feel it is through these vast majority of interactions of trust between patient and pharmacist, where the pharmacist ensures that the medicine given is both safe and effective, where you will truly make a difference in the realm of public health. Today, we also celebrate the Clara Aragon Memorial Day. Clara Aragon Villanueva was the first dean of the PW School of Pharmacy in 1926 and led the school for 20 years before she was given the title of Dean Emeritus. More importantly, Clara Aragon was one of the 7 women founders of PWU, who, together with Francisca Tirona Benitez, desired to put up a school where women could find equal opportunities for education and where they were given a progressive, holistic education highlighted with a thrust to community service. Going through the PW archives, one will discover that Clara Aragon, or Clarita, as she was known then, was not only exemplary in her academic prowess, but was a well-rounded individual. She possessed artistic and literary skills, which made her a popular figure at the Philippine Normal University, where she took up her secondary education. According to the archives, and I quote, "She could declaim, sing, and play the piano. Her scholarship and active participation in both social and civic undertakings distinguished her as a leader and a well-known campus figure. Always ambitious and civic-spirited, she chose pharmacy as the career which would launch her on the road to success and also enable her to be of service to her community. Today, as we celebrate World Pharmacist Day and Clara Aragon Memorial Day, let us draw inspiration from the icon herself. She believed that it was not enough to be successful as students and later on in your chosen profession as pharmacists, but equally as important is to be well-rounded individuals with a desire to contribute to the good of our community. And that is the message I leave with all of you today. Be great pharmacists so that you may catalyze and transform the realm of public health. But equally important in the context of our society today, be great persons so that you may make a difference in the lives of your fellow human beings. Thank you, and may you have a productive and insightful afternoon.
Sir, you're on mute.
Here from the President of the Philippine Pharmacists Association, Ms. Maria Hilda S. Salhay.
Mr. Harvey Adamson, Program Chair of Philippine Women's University School of Pharmacy, faculty and staff, FJCPPHA officers, the organizing committee, honorable guests of this event, pharmacists, colleagues, friends, ladies and gentlemen. It is indeed an honor and a challenge to serve as the 22nd President of the Philippine Pharmacists Association and the 8th woman president, especially during these most difficult times brought by COVID-19 pandemic. I am truly humbled for this opportunity to serve the association and the countless patients and families and the entire profession that will benefit from our work as leaders. Amidst this crisis, the role of pharmacists has not changed, but the communication methods that pharmacists must adapt to provide information and quality product has changed rapidly, as well as the physical changes within the pharmacies to protect themselves, their colleagues, and their employees. And I'd also like to thank Philippine Women's University School of Pharmacy for actively organizing worthwhile events like this, being one with the rest of the world in celebrating the World Pharmacists Day. This is a way of supporting pharmacists all over the world because together we will seek and seize opportunities to fulfill our common vision, and that is transforming global health. We are still challenged to establish the value we add to healthcare and to patient safety specifically. We are taking big strides towards getting more pharmacists in the game. And I would like to congratulate you, young pharmacy students, for choosing pharmacy as your future profession. You will be the future leaders. You will be the future movers of better healthcare in the country and even the world. You do not wait a lifetime to be a leader. You can be a good leader now by simply leading your own self to be a responsible student. You can be a pharmacy student leader and be a significant professional pharmacist of the nation in the near future. Learn what you need to learn. Do not study for the exams. Study to learn and benefit from it. Your teachers and our other pharmacist colleagues could be your mentors, your guide, your role models to follow. Take advices, take whatever lessons you can carry with you to bring you to greater heights. Leadership is a continuous process, and we do things not for our own glorification, but for the people that we serve. And one of the privileges of this being a leader also is that we get to see and meet so many pharmacists, so many healthcare practitioners, and there are countless stories of pharmacists working hand in hand with other healthcare professionals, patients, and caregivers to make a difference, to better patients' and families' lives. Those stories should be shared to make the point clear that we are important health providers. And at the core of all of us studying, learning, coming together is patient safety. Plain and simple. Patient safety. During this COVID-19 pandemic, patient safety connects all pharmacists, and it is at the core of what we do. And that's what I want to focus on during my term as president of PPHA. With the other competent speakers and guests in their respective fields today, it is my hope and prayer that this event will achieve its objective to hype you up with the current situation and how important it is to be a pharmacist, especially during this unprecedented time. And may the good examples of our fellow pharmacists be reflected and be replicated to pursue our mission. And as we continue serving for the next 100 years, together we are making a difference. Together we are expanding opportunities in patient care. Together we are improving patient safety. And together we will keep up our great work for the broader community and most of all, for the people and for the families that depend on us each and every day. So do your part. Do your part as pharmacy students, and we are doing our part as pharmacists and as leaders. The message we want to echo in the minds and in the hearts of the public and the government is that we are pharmacists. We are indispensable in healthcare. So kudos to all of you and happy World Pharmacist Day to all. May we reflect on how we could be essential and valued part of the healthcare now and in the future. God bless and be safe always, wherever you are.
Thank you so much, President Maria Hilda Salhay. And now, to start our webinar, let us call on our first speaker. He is a certified pharmacotherapist for infectious disease. And he is also a college professor from Our Lady of Fatima University, and is a lecturer of the Philippine Association of Colleges of Pharmacy. Ladies and gentlemen, please help me welcome Mr. Paul Anthony Balbero.
So good afternoon, everyone. First and foremost, I would like to give this opportunity to give thanks to Ms. Riza Kaluwag, a professor from the School of Pharmacy of Philippine Women's University, for giving me this opportunity to speak in front of many audiences. And also, I would like to extend my appreciation also for Mr. Harvey Adamson, the Dean of the School of Pharmacy of Philippine Women's University, for again giving me and gracing me this opportunity to speak in front of you. So for today, so this will just be a short forum and discussion entitled Transforming Global Health through the use of social media. So again, I'm Sir Paul Anthony Balbero. I'm a former professor of Our Lady of Fatima University, and I am a qualified infectious disease expert, pharmacist. So let's start. So for the objectives of this discussion, so firstly, we're going to define and give definition and description of what social media is and its impact on social health and the health of everyone, and also in terms of its impact on the health profession, which is the pharmacy profession. So we are going to look at some statistics on social media use, on how many people are actually accessing social media in terms of getting information about healthcare issues. Online health seeking behavior patterns that we should see. We also have here participative medicine and healthcare social media, which is what we call the HCSM. So uses and benefits of social media for health communication. Examples of these platforms, HCSM platforms. So when you say HCSM again, so it's healthcare social media. CDC, Health Communicator Social Media Toolkit. So this is the Center of Disease Control and Prevention from Florida, USA. They have come up with a media toolkit to guide programmers on making social media websites that will help patients to reach more genuine information about healthcare. And lastly, in the objectives, we have the limitations of social media for health communication. And since we know that everything that we do on social media is not that reliable, and every information that we get are not that reliable, so we need experts to read, to proofread, okay, to make sure that all informations that we get as patients are reliable and beneficial to us. So let's define what social media is. So according to Merriam-Webster Dictionary, so it's a form of electronic communication through microblogging, through which users create online communities to share information, ideas, personal messages, and other contents. And just like what a person, a very relevant person nowadays said, that with just one click, you can give lots of information, whether they are valid or not. So social media is very powerful nowadays, and we should use it intelligently and wisely. Okay, both for the programmers, of course, and to the user end. Okay, so another definition of social media is a group of internet-based applications or programs that build on the ideological and technological foundations of Web 2.0. Okay, so I'll be explaining Web 2.0 compared to Web 1.0 later on, and that allow the creation and exchange of user-generated content. So this is a form of program nowadays. Now, it's a website term or jargon nowadays that tells us what informations are being acquired by consumers and patients nowadays, or whoever user nowadays, and how about the words that they put or get in terms of returning these informations to other people. Okay, so in the jargon term Web 1.0, so it's a cycle in which many people get information from the web or from the internet, but only few get or give a feedback. Okay, so because today we are going to talk about what is the relevance of people also giving feedback, correct feedback from the information that they get from the internet, giving it back to other people, because it's just like a word of mouth. So if you are satisfied with the service that you get from the products that you have acquired, you will give the right information and right access to that products and services. Okay, so compared in this Web 1.0, so this was popular during up to 2010, I guess. So 250 websites were offered by the web, giving information to the users. While now, 2010 up to the present, 2020, so we have what we call, the term now is Web 2.0. Okay, so it gives access to millions of sites to consumers, in which these consumers, once they get the information, they can also give back the information or feedback to other users as well. So in that website, kumbaga, they have what you call an access to giving what you call this, follow-ups, feedbacks, and endorsement to other people. That the information that they got, the products, the services that they got are well reliable and genuine, and they are satisfied. So this is what we want nowadays, the Web 2.0, wherein published contents, informations, and services are gotten by people, and a lot of people respond. Okay, because nowadays, guys, now we should make it to a point that there should be healthcare communication. Social media should be used in the form of giving healthcare communication, not only one-sided information. Okay, we should not only just get without giving also the right information to other people as well. Okay, so what are the different social media types? So as you can see in this slide, so what are the ones that we are familiar with? Social networks like Instagram. So maybe most of us use Instagram, ano? Facebook, microblogs. So if you're fond of blogging, so blogs, wikis. So Wikipedia is one way of getting information, but as we all know, not all information are proofread. So we should be careful about the information that we get from Wikipedia. So thematic networks. So it's an analytical tool for making researches. Your forums or your listserv. So it's just a main electronic platform. Okay, and other modes of information gotten by people through social media. Okay, so social media is very powerful. Okay, so sabi nga, di ba, you should think before you click. I forgot the person who said that. Okay, so every information that we get, every information that we give of ourselves in social media, we should think before we click. Okay. Okay, so let's try to see some statistics on how people make use of social media in terms of accessing information, particularly on healthcare. So what does this slide show us? So it just show us the comparison, okay, and then the nearness of data of the total number of people who actually use social media, okay, percentage of people around the world. So I think we are already 7 or 8 billion around the world. So 1.4 billion have access to social media. So that's a lot of people accessing social media for information acquisition. Compared to the active social users, compared to the actual social users, social media users using cell phones. So kumbaga these two circles here give us the idea that 35% of people worldwide make use of the social media in acquisition of information. Okay, and 33% of this is via using their cell phones. So I think all of the people that we know now around the world have access to cell phones. Now, some of us may even have 2 or 3 cell phones. So out of the 35% of the people getting information, okay, nowadays, is they use it through cell phones. So you see the accessibility of the information. So with just one click of your cell phone, no need to even get your laptops. So you can get your information already. Okay. Another thing is, of course, no, we are not left behind. Actually, we are the leading user of social networking in the world. Okay, so of course, all of the nations here around the globe uses internet and social media to gather information, no, for information acquisition. But then the Philippines, again, it's more fun in the Philippines. We're always number one. So we make use of the social media most of the time compared to other nations around the globe. So maybe other nations, they get information directly to doctors. They go to hospitals, and some may even read books or read journals. But then people in the Philippines now, we like comfort as much as possible. So we just one click of the Google, no, one click of your cell phone, accessing Google, you have the information already. Okay. So that's it for the statistics. Next. So almost everyone is using social media. Okay. So in terms of the time spent, okay, by people, sorry, nag-lag siya. Okay. Yeah. So in terms of the time spent, again, Philippines is number one. So followed by Brazil, no, South America, Mexico, what's this, Argentina. So mostly, no, in Asia, we're the leading user of social media, and we spend lots of our time for that. That's why if you get your cell phone, you try to see if you have your iPhone with you, your cell phones with you, you can see how much time you spend in social media in using your cell phones compared to your productivity. Di ba meron ganun sa cell phones natin? You try to see every day how much of your time is spent in cell phone and using social media. Okay, so we are number one in Asia, and the rest are South American states. So almost everyone is on Facebook. Now we can do everything in Facebook. Okay, we can do business in Facebook. Ako, I'm doing business in Facebook. So boosting my posts, etc. So why not use this as professionals, as health professionals? Why not use Facebook, okay, Instagram, Twitter, not to spread correct information? Why don't uh, professionals, healthcare professionals, do a collaborative effort to make use of social media to providing right information to patients? No? So it's one challenge, no, to us health professionals. Okay. So the question, the biggest question is, can social media be used for health promotion and education? Of course, yes. Okay, so that's a cliche question because this is a recorded session. So I think, but I think we will be having an open forum for this so that we can ask questions. So can social media be used for health promotion and education? Definitely yes. Okay, definitely yes. And I hope as professionals, we do collaborative effort. No, we do conglomerate, no, in making something big out of this, no, to give the right information to our customers and patients as well. Okay, so personally, I feel, okay, so just like what Dr. Howard Lux said, okay, so personally, I feel to ignore the intersection between healthcare and social media is to potentially ignore our own relevance as a healthcare practitioner during the next decade. So, kumbaga parang Dr. Howard Lux is saying that he doesn't see, no, the effort done by people, okay, in terms of just using social media for entertainment. No, why don't you use social media for other things as well, like giving, no, healthcare informations, no, even for free, no, to people who needs access nowadays, lalong-lalo na it's a pandemic. Okay, so everything is online. No, no one can afford, no, only a few can afford going to hospitals, and even for safety reasons, they can go face to face with doctors. Why don't we offer this for free, or we offer this in as much accessibility as possible? Okay. So according to statistics again, 48% of people using social media and digital medical information sources believe that tools have helped them achieve a better health outcome. Okay. Why is that so? Because I told you that social media is just one click away. So if you are a doctor and you are concerned with the patient, with just one click of your tab, okay, of your cell phones, you can give e-prescriptions, you can give the right information on how to take medicines, no, and how to take care of yourself, okay, during a time of disease to your patients, no, without even going to be having to face to face with the patient. Okay, that's how good social media can be if it is in the hand of the correct professionals. Okay. So according to another statistics by the Pew Research Center, so 72% of internet users said they look online for health information within the past years. So since it's a pandemic nowadays, nobody is leaving their homes. So statistics have said that these are the reasons these are the reasons why people use social media on acquisition of information, health-related information. So the biggest percentage falls on researching on specific diseases or medical problems. So if, just like you, if you feel something unusual, during the day, what do? Okay, you don't just call the doctors immediately, if you have an access to your family doctor. But then you just call, you just click your cell phone, go to Google. Google has become the doctor of many, especially Filipinos nowadays. And the problem with that is not all information given by Google pertains to the symptoms or pertains to the disease that you are suffering in relation to your symptoms. That's why, we have many memes nowadays in Facebook. I feel like this, I feel like that. But then when he searched the Facebook, the Google, whatever platform, he got the wrong information. It even says that you have cancer, HIV, and whatever. No, it's not the correct information. It's not the correct way of using social media. So what other certain reasons, okay, searching on certain medical treatments or procedures, so self-treatment, self-medication is very rampant nowadays because of this, okay? how to lose weight, no, even nutraceutical and nutrition information are being acquired through Google and other social platforms, medical test results, no? Even medical test results, no? Actually, for medical test results, since it's a standard, what do you call this? You can get the standard limits of your test results. No, I think it's reliable. But then for the other underlying symptoms and disease that you are undergoing, no, you should not just consult Google itself. Okay, you should go to direct professional services from doctors. Yeah. Okay. 88.79% of respondents said they ever looked for information about health or medical topics from any source. Okay. So these are the percentages. Again, the different reasons why people use social media, okay, for gaining health related information. So we will not go through this anymore. Okay. Or some of it has been very useful because just like with this, no, in terms of healthcare, percentage of people searching for medical topics, no, so they look for providers. Okay, so hindi naman laging information lang kagad directly, no. So some people use it for looking for providers online. Okay. Okay, how online searches affect health decisions? So this is the biggest dilemma. Okay, how does it affect the overall health of our patients? Okay, so 60%, okay, affected a decision about how to treat an illness or condition. So this is where self-medication comes in. So I think it's almost 90 to 100% wrong to self-medicate. Okay, lalo na if it's not just a simple symptoms that you are feeling. Okay, so 60% of people self-medicate because they saw, okay, how to treat their symptoms online. Okay, and hindi natin alam, iba na pa rin nararamdaman nila. Okay, 56% changed overall approach to maintaining health. So social media impacts their look at their well-being. Okay? For example, you think that you're fat, you think that you're not physically fit. No, social media affects you. Okay, I think that's good. No, you see people who are physically fit. Okay, but then not everything is being seen physically. Okay. 53% led to asking new questions or getting a second opinion. So I think this is a positive impact. So you don't just settle for one information, you get it from other sources. Change the way of thinking about diet, exercise, stress management, okay? Affected a decision about whether to see a doctor. So I think this is not a bargain, okay? If you feel something wrong, if you think that your health is at risk, no, there's no such other option but to go to doctors. Okay? So tingnan nyo, 38% lang siya. 38% lang yung nag-decide na since they got the wrong information, they saw that they are not yet satisfied with the information in the social media, they think that they feel that they have to go to the doctor. And it should not be a discount. No? Dapat talaga, that's the first option. Go to the doctor. Okay? Or to the pharmacist, of course. Okay? Change the way of coping with chronic condition or managing pain. Okay? So, ayan po. What are this? Okay? So, these are just some other statistics, giving us data on information acquisition through social media. Okay? So, social media explained with healthcare. Okay? So, this is how we can be of relevance to the community in terms of giving information through social media. Okay? So, ayan. So, but since in Facebook, you can just click a status, you can just put your status with just one click, okay? So, you can give either not so good information or the best information to other patients as well. For example, so if you feel satisfied with your services, the services that you have received from a hospital, you can just put on your status, I like my local hospital, and you tag your local hospital, okay? I have a question about my bill from the hospital. Just one click of your Twitter button. I work at the hospital. So if some people saw that you are working from a hospital, they can contact you immediately. And knowing that you are a health professional, they can trust you. Okay? So this is how social media works, in terms of giving the right information to patients. With just one status away, people can get the right information. Okay? So if you are a health professional and you want people to get the right information, if you are willing to give it, no, why don't you just put on your status, no, if I'm a pharmacist, I'll be willing to help you, no, in every way I can, as long as I'm available. If you're available, right? I'm at the hospital, let's get together at the hospital. So proving the fact that going to health professionals is still the best option. Okay? Yeah. So social media, guys, it's not just only for entertainment. It's also for correct information acquisition. Okay? So another research from Pew Research Center in the United States. So reasons online health information seekers use the internet to connect with others. Okay, so you can just go through this. Okay, what's the highest percentage? What's the reason why people, reasons online health information seekers use the internet to connect with others? Okay, to see what other consumers has to say with the treatment that they have received. Okay, so again, no, our favorite words nowadays phrase is, in terms of social media, there should be healthcare communication. Okay? We should connect the world. Okay? Dapat meron tayong mga words for the day, mga phrase for the day. Healthcare communication, and we should make it a connected world. Okay? Connected world. Okay? Di ba sabi nga, I always forget, no, people who are saying great quotes. Okay? May nagsabi, no, so power is not eminent nowadays, no, in terms of the social media. Okay? So in terms of power of command, power of held by few, power held by just doing transaction, it's not eminent nowadays. Because what's eminent nowadays is what you call the new power. And the new power tells us about, if the old power is having people getting an access to information held by the few, the new power nowadays that eminent is many, okay, information held by many. It's a two-way process, giving and receiving information. Another one is the power of command, okay? Information is commanded only by one person, sorry, okay, by one person and a few people. Now, okay, many people are now sharing, okay? The opposite of command is sharing information. And last one is, if you're just doing transaction, okay, now what we do is relationship. Okay, so tandaan nyo na, so the old power and the new power. So held by a few, information held by a few, information held by many, okay, accessible to many. Okay, information commanded by a few, but then now it is now shared. Okay, and again, transaction being made now, it's now all about relationship. Okay. So ayan. So health information seekers reported most frequently going first. So this is what is sad, no? In this inverted pyramid, we see that most people access social media and internet first, okay? In getting researches on what they feel, on the diseases that they are experiencing nowadays, and giving only 15.66% to health professionals. No, so this should be the other way around. Ayan. So since if this is a disadvantage, we should also see an advantage to this, right? So what advantage can we do? Can we see through this? So why don't we use internet and social media, so that doctors and other health care providers give the right information to people? Okay, that's where websites like Mayo Clinic, WebMD does, okay, or do. Okay. Ayan. So since we can say, okay, the clinicians are still not the ones who remain to be the central source of health information care or support. It's not just the social media. Okay, it's not just the internet itself. The information to get to the internet. Okay, of course, journals and books can help, but then the knowledge and expertise of the health professionals are still of relevance. Okay, nowadays, it should not be compromised and bargained. Okay. Ayan. Okay. So what does this tell us? Okay. So getting and sharing information can be done, okay, via doctors, information giving to patients, via hospitals, via pharmacy to the patients, okay, health insurance companies, retail, clinics, etc., etc. Okay, so different percentages, okay, of relevance in terms of giving, okay, access to healthcare information to patients. Okay, So now we are now going to talk about the different toolkits and kits that we should be aware of, in terms of providing relevant information through social media. Okay, so what are these? Okay, so we have what we call the informed and activated patient approach, chronic care model approach, and prepared and proactive practice team, which is just a combination of the informed and activated patient and chronic care models. Okay. So, and these models or toolkits on providing healthcare information through social media can be accessible and can be done through programs and websites using social media platforms. Diba? So you can use everything on social media to practice all of these toolkits and programs. Okay. So health information access for patient is a key facet of the provision of patient-centered care. So, di ba, sa pharmacy, dapat tayo ay patient-centered, no? Compared to being just product-centered or drug-centered. So, patients require appropriate health information. So, take note of the word appropriate in order to participate in treatment decisions and increase communication with their doctors or healthcare providers. Okay, so this is all happening, or we all do this for better health outcomes. Okay, so I don't know if you are familiar with the DMJ clinic or DMJ website now. So they are now having a campaign in which they promote or they prove what they call the e-patient. So what do you mean by e-patient? So if you research in Wikipedia what an e-patient is, it's a patient which is who is involved in his or her own healthcare outcomes. Okay, so as we all know, since we make use of the internet, the social media, so nowadays, and usually the face-to-face sessions with doctors are not so much popular nowadays because of the pandemic. So we make sure that patients should also be involved in their healthcare outcomes because they are the ones who are going to be taking care of themselves in their homes. Okay, no one will take care of them if they don't want to go to hospitals, if they are not even experiencing chronic diseases and ailments. No need to go to the hospitals. So who will take care of them if they don't have nurses, pharmacists, and doctors around them? It's them. So what this campaign is giving us is that patients should also be involved in their healthcare outcomes, and they should be called e-patients as well. So an e-patient is a health consumer who participates fully in his or her medical care. So dapat involved ka. Okay? Since everything is done online, bahay ka, doctor is in the clinic or in his or her own home. So no one will take care of you but yourself. So you will be an e-patient. Okay? So participate, okay, on your own medical care regimens or regimens. Okay? So kanina, no, we have what we call the Web 2.0, in which I told you it's a campaign, it's a website jargon nowadays, telling us that information acquisition should also have a counterpart, information distribution. So ngayon, ang tawag na natin ngayon, okay, so it's actually good to know that many health professionals are conglomerating and contributing to what they call the Health 2.0. Ayan. So Health 2.0 is the use of social software and its ability to promote collaboration among patients and medical professionals, okay, for better giving of healthcare services, okay, so involving other stakeholders in health. Okay, so dapat lahat, okay, involved in terms of the use of social media in providing care and medical information to us. Okay, so ayan, so about Twitter, Pinterest, Facebook, I don't know this one. So everyone should be involved in using social media, okay, in terms of giving, okay, and distributing information, healthcare information. Okay, so key social media interaction among patients, physicians, and the public. Okay, so this is just a diagram showing us that this Health 2.0 campaign so gives us an idea on how information should be distributed among three facets, okay, the physician, the patient, and the public. Okay, so physician conglomeration is important, and physician collaborative effort, giving the better information to patients, and patients also giving the right feedback to other patients as well. Okay, and ayan, so to the public. Okay, so physician and patient information collaboration, if it's now already well established, can now go out to the public. Okay, so ayan. Okay, social media usage and different divisions. Okay, the use of social media in terms of healthcare provision have 4 divisions. No, first one, it talks about the users. Okay, the functions of the social media in terms of healthcare service provision, the objectives, why do we use social media, and of course the outcomes that we expect. Okay, so the users and functions of social media to create health awareness to the use of social media. Okay, so take note of the 4 aspects of social media for provision of healthcare services. Okay, so the users, the functions, and the objectives and the outcomes. Okay, so pinaka-important of course is the outcomes. No, there should be an outcome. There should be a positive impact in the usage of internet and social media for provision of healthcare. Okay, so next we'll be talking about the 5 C's of social media. So consume, pertaining to consumers, converse, the communication, okay, the collaboration among health professionals and even the patients itself, the communication, okay, to communicate, and of course, all of this, if you put them together, it gives you connectivity. Okay, di ba sabi ko nga kanina, we have 2 words for today. Those 2 words, those 2 phrases are your healthcare communication, no? It should be a popular word nowadays or phrase nowadays. And what do you call this? Connected world. Okay, we should be a connected world. Okay. So 7 main uses of social media for health communication. So you can just go through this. Okay. So the different benefits of social media for health communication. So of course, the most important here is the increase in interaction with patients and the right professionals. Okay. Accessibility, emotional support, healthcare follow-ups and surveillance. Okay, and influence. Okay, I think one a facet of the relevance of using internet, no, for healthcare provision is through follow-ups, no. Since if you are a doctor and you have a patient, okay, you're treating a patient online, you get all of the information, not personal information of the patient, just like the telephone number, the cell phone number of the patient. You can always do follow-up. Kasi follow-up is being taken for granted nowadays, no? When the doctor and the patient meets in the clinic, once the prescription is made, once the treatment is made, once the communication is made, it all ends there. Because we all know the patient will be treated, no? The patient will be well for quite a time. But then, once the symptoms prolapse or relapse, okay, follow-up is being taken for granted. So, through the use of social media and internet, since we are getting, if we are doctors and we are pharmacists, since we are getting the information to our patients, okay, personal information, we can always do follow-up. Since we know their cell phone numbers, we know where they are right now. So these accessibilities and informations that we get from them can be used, no, to make the aspect of follow-up be of importance nowadays. Kasi I think yun yung nalilimutan, no? Ginamot na, gumaling na, tapos bumalik, walang follow-up. Okay, kahit naman actually hindi gumaling or kahit gumaling na, okay, the patient should always do follow-up. And the patient, of course, will not initiate to do that. The health professionals have the responsibility to do follow-up. Okay, so that's one relevant advantage. No? You can do follow-up because you have the cell phone number of the patient. If you really care for your patients, you do follow-ups. Okay. Yeah. Okay. So we have many platforms. No, I don't know. Can you name? Sige nga, let's have a game. Can you name these social media platforms? Ako, talo ko dito. This is, what's this? Internet Explorer ba to? Okay. I don't know. What's this? Pinterest lang ang alam ko. What's this? No, isa lang ang alam ko, di ba? What's this? I forgot. How about this ones? Facebook, Pinterest, what's this? Google something. Twitter. Is this also LinkedIn ba to? I don't know. Ayan, so yeah, Skype, Twitter. Ayan. Can you name all of that? Pero nagpa-game tayo, no? Can you name all of these social media platforms? Okay? So, ayan. So, what are the toolkits? What are the programs being done nowadays? So, I have mentioned kanina. Okay? So, in order for these programs to trend in, okay, para mag-trend in sila, no? So, healthcare professionals, since they do collaborative efforts, they put hashtags on every post that they do, whether in Instagram, in Facebook, ano pa ba, Twitter, no, they use hashtag like this. Okay, HESM, HIP, healthcare social media, di ba? HESM, LCSM, HIP, etc. etc. So, bakit nga ulit may hashtag? Kasi di ba to reach greater audiences. So, I think this is a very intelligent way, no, to accessing greater audiences, no? If you really want to help people, no, you want to reach more. So how do you reach more? Ayan, hashtag. Di ba kayo pag maraming gusto nyo mag-like, kailangan may hashtags. Di ba pag may hashtags daw, no, tsaka may mga tweets na ganyan, it may even reach, what is this? 1 billion audiences compared to not putting hashtags. So kayo guys, no, if you are already part of these platforms, yung mga ganyang websites and social media platforms, you always use hashtags so that it will reach greater audiences. Ayan, so let's just go over some of the websites that are existing nowadays. Okay, so I think in the Philippines now, we have what we call the Health XPH. Ayan, wherein you can put, no, comments, etc., tags. Okay. Ayan. So this social media platforms that the health professionals are doing now is a form of collective intelligence. No, it's a form of crowdsourcing. Okay, so crowdsourcing in terms of gathering more health professionals to be part of the website so that they can help more people, and also crowdsourcing in terms of people, patients needing those information, so that they will have an interaction and access to the right professionals. So more healthcare professionals in that website, more queries can be answered. Okay, more patients will be reached and be having an access to the right information. Okay, kasi ang goal natin talaga dito is giving the right information, no? Not just click information from the internet. Okay? So, ano pa? CrowdMed. Okay, I'm not so much familiar with this one. CrowdMed. Social media is an ideal platform for healthcare professionals. So, I think, no, as of now, we already know, no, the importance of social media. Okay? The advantage that we can use of, okay, for these platforms to be used for healthcare service provision. Okay, ano pa? So other websites like this, some websites like this Sermo website, no, they even do different polls like this. Merong Sermo Solves, no, if you want to have your questions be answered. Sermo Polls, no, may mga pa-vote sila. Okay. Sermo Says, okay, mga peer information, peer reviews, okay, and Sermo Research, no, if you are fond of research, you can also put your journals here, no, and researches so that people can access that through the website, and of course with pay, of course. Yeah, so if you want to earn, if you're a doctor and you have researches that can benefit, no, people worldwide, you can upload this here and you can earn. Okay. Ayan. The Student Doctor Network. Okay. Ayan. Live Better Together. Patients Like Me. So ito naman, more on patient collaboration ito. So patients doing support with one another, okay, support care, emotional care. So websites like that are also existing. Okay. It's also a form of a social media way of connecting to people. Connect with others having the same disease as you, so that you would have emotional support. Data for Good. Okay, some websites also ask for donations, no? Of course, the most popular ones, WebMD, okay, Apple Patients, okay, patient portal, etc. Okay, I think in the Philippines, no? So this one is the Neurofibromatosis Friends of the Philippines. So even Facebook, no? Facebook cannot cannot just be Facebook itself. Okay, you can do web pages also in Facebook pages, no? And with just one like and follow of a patient, other patients will follow as well. Okay. Mayo clinics. Okay, no, you can even get an appointment to online doctors. You see how accessible that is. Dana Farber, and of course the Philippine General Hospital. So they already have a website nowadays. Okay, so you have the tab here for emergency patient and visitor room. Okay, if you want to ask PGH doctors, if you want to donate as well. So I like how simple and what do you call this? Yeah, how simple this website is, no? We just one look at it, no? It's clean in the eyes. Oncology in the era of great chances. Okay, so the Philippine Society of Medical Oncology, they also have a website. Okay, yeah. So all of this, no, all of this are proof of the importance of social media in terms of getting the right audiences, no, getting the right information, no, from health professionals, and sharing the right information to other patients as well. Okay, so social media is a powerful tool for public education and advocacy. Okay. So again, we should do social reinforcements, okay? Because social media can be used for better awareness, better interest, and better action for social reinforcement, most especially in terms of healthcare provision, okay? Yeah, so other platforms as well. So also, no, different images, no, posters being posted on social media are also forms of ways by which you can reach people. Okay, so yung mga journals like that, yung mga posters, okay, can also reach people since everyone is on their phones, okay, most of the time. DOH, okay, so we are the nation known for breaking the internet by pushing hundreds of millions of tweets about noontime show segments, all about entertainments. Filipinos' increasing reliance on information and communication technology means that we now have a huge wealth of data in our hands. Okay, so no problem with that. Okay, so we have the access to unlimited information. Okay, it has significantly altered the way we work, learn, play, and live. Okay, lalong-lalo na ngayon that everyone is just relying on the internet. Okay, sabi nga nila, it's a necessity nowadays. Okay, but the question is there value to social media in Philippine healthcare? And that's the biggest question. Okay, if Filipino health workers, health professionals will not do a collaborative effort, just like what other nations are doing, just like what other nations are putting up, like their websites, I think the value of social media will not be of what do you call this? The value of social media will not be of relevance. Okay, it will not be so much of an issue. Okay, in terms of giving healthcare to as many Filipinos as possible. Okay, kasi it's up to us. It should start on us. Okay, with just you as a health professional putting up a Facebook page of your own. Okay, so what do you call this? And some of your friends who are also health professionals have an access to that, like that, follow that, okay? And patients can see your Facebook page, okay, anytime, anywhere. So I think that's a big leap already, okay? Kasi sabi nga nila, di ba? So the what do you call this? The form of literacy of Filipinos are very high, okay? The levels, of literacy of Filipinos are very high. Diba? In terms of education, we value education very much. But then, to the use of internet, parang hindi ata nagagamit yung high literacy rate natin. Okay? Because, sabi dito, the low level of health literacy, we are, in terms of education, we are highly literate, but in terms of health literacy, we are illiterate. Okay? Because, tumataas pa din, yung levels of people who are unhealthy nowadays, to social media. Okay? Unhealthy nowadays, many people are still sick, despite of the information that we can access, unlimitedly. Okay, so ang sabi dito, the low level of health literacy is a major factor in the issue of significantly decreasing the number of unhealthy and sick Filipinos. So it's very alarming to know that, no? We have high literacy, but then health literacy, we are very low. Okay? So Dr. Anthony Leachon, president of the Philippine College of Physicians, said that when patients come to healthcare professionals to seek medical advice, they're already very sick. Okay? Because, yan, sabi nga natin, diba, 68% of people get information first through websites and internet. No? Last option na lang ang doctors. So that gives us an idea how unhealthy, okay, Filipinos are in terms of their level of literacy, okay, on healthcare acquisition. Okay? Ano to? Isang sikat na tweet. Okay? I'm active on social media because there are many snake oils, salesmen online, and too few doctors. We need more health info in the Philippines. Okay? So, ayun po. So that's a problem, I think, that we should face. Okay? And it's the biggest challenge. Okay? So, ayun. Many doctors, but then many are willing. Few are willing. Nakikita na tayo. Okay? Few are willing not to help. Few are willing to give access not to their knowledge. Okay, so we should do collaborative efforts. Okay, not only doctors, even pharmacists. If we can put up a page or a Facebook page on your local community in which people can see that you are a health professional, that you can be trusted. Okay, in terms of their well-being. No, why don't you do that? Okay, it's just a click away. No, let's use social media for the greater benefit. Okay. So, ayan po. So, these are just examples of Facebook pages. O, diba? So, how do you reach audiences? Yan, you boost your post. Pero may budget ata, I think, for this. No, mostly boosting pages and posts are done by businesses. Pero, no, talagang mapagkawang gawa ka, diba? If you want to reach more people and health professionals and patients, no, you can boost your post. No? Kawang gawa. Okay. So, ayan. And many are doing that. No, many are doing that. No? So, they want to reach greater audience, okay? Whether just to help people, no, they do that. They boost their post. And of course, yan, hashtags and testimonials, okay? Lalo-lalo na if you have many followers, thousands of followers in your account, no, you can have an access, no, to greater audiences and help many people. No, giving the right information, directing them to the right professionals, and directing them to the right way of usage of social media. Okay? So these are the toolkits, finally, of the CDC, the Center for Disease Control and Prevention in the United States. So these are the, what do you call this, the advices, okay, that you can take note if you are putting up your social media platform to help other people, if you are putting up a program, not to have a collaboration with other health professionals and to getting more patients and audiences, no, accessing your websites to help them. Okay, so this is, ayan, the different toolkits, okay, or enumerations given by the CDCs, okay, in terms of, yeah, strategies. And lastly, of course, we also have limitations of social media for health communication. And these are the limits. Ayan. Okay. So limits in terms of the general public, key advantages, patients, and healthcare professionals. Okay. So pinakamalaki pa rin talaga yung lack of reliability. Okay. And paano po yun if it lacks reliability? So we make sure that people are using social media not to connect with health professionals. Now, not only to connect with journals, not only to connect with Google, not to connect with the description in the internet about their diseases, but to connect, use their social media platforms to connect with true doctors, no, true caring health professionals, no. Dun dapat ginagamit ang social media, no, to connect. Okay, again, our term now, diba, today is the connected world. Okay, and of course, healthcare communication, and connected world, no, should be our hashtags. Sige nga, no. So I challenge you, after this discussion, you make a post on how to use social media on the advantage of healthcare provision, and you put hashtags like connected world and healthcare communication. Okay, hashtag, okay, healthcare communication and hashtag connected world. Okay, so thank you so much. So I will want to quote this saying by Dr. Kevin Fo. Okay, so ano sabi niya? Social media is where the future is. So we should make the best out of it. Okay. And most importantly, that's where our patients are going to be. Okay, so thank you so much for this opportunity again, Philippine Women's University and Ma'am Riza for giving me the opportunity to share. Okay, a very relevant topic on how social media can impact, okay, the better provision of healthcare for the Filipinos and of course, the Philippines. Okay, so thank you so much.
Again, thank you so much, Mr. Paul Anthony Balbero. Indeed, pharmacists or future pharmacists should use the social media for the benefit of our patients and also our community. Again, hashtag healthcare communication and hashtag connected world. Again, thank you so much, Sir Anthony Balbero. And now, for our second speaker, she is currently the president of Asia Pacific Institute for Medication Management. She is the former president of the Philippine Pharmacists Association and currently part of the executive committee member of Community Pharmacy Section on International Pharmaceutical Federation. She is a very well-known speaker in the field of pharmacy. Please help me welcome Ma'am Leonila M. Ocampo to discuss transforming global health through application of evidence-based research into common practice.
President Marco Alfredo Benitez of the Philippine Women's University, to the Philippine Pharmacists Association President, Mrs. Hilda Salhay, to our Chancellor, Senior Vice President for Academic Affairs, Dr. Felina Yang, Dean Harvey Adamson of the School of Pharmacy, faculty of the university and faculty of the School of Pharmacy, university alumni and students, guests, good afternoon. I would like at this point to thank Dean Harvey for the invitation accorded to me to speak on the topic Pharmacists Transforming Global Health through application of evidence-based research into common practice. Let me start by greeting everyone, all my fellow pharmacists, alumni of PWU, and all pharmacists out there viewing our discussion today. A happy 100th year of the Philippine Pharmacists Association, happy World Pharmacist Day, and a happy celebration for the Philippine Women's University of the Clara Aragon Memorial Day. Let me start my discussion by sharing with you on what the former Director General of the World Health Organization said. And it says, the challenges facing public health and the broader world context in which we struggle have become too numerous and too complex for a business as usual approach. The message of what the former Director General of WHO actually is now viewed as a pre-warning on what we are experiencing today of the pandemic of the COVID-19. Healthcare is quite broad. So the topic that is assigned to me is quite a very broad topic to be discussed that I decided, and I hope Dean Harvey would be with me in this decision that I've made, that we will focus the discussion on the pharmacist roles, on how they could transform global health. Pharmacists, who are the safekeeper of one of the important tools that propel the delivery of health services in a country and in the world, which are the medicines. Collaborative medication management, primary care research team said, for every dollar spent on medicine, nearly an additional dollar is spent addressing medication drug misadventure. Actually, this statement of CMM supports a report that was given in October 2019 of wastages happening in healthcare that amounts to more than $16 billion 7 years from now, which currently is computed or estimated to be at $10.7 million. Why? For various reasons. And one tool which we were mentioning in the previous slide, medicines, is one of the greatest contributor to these wastage. And therefore, I would want to say, and the world also has said, that pharmacy has to change. It has to change, and it should continue to change as the steward of these products called medicines. Let's have some definitions. Transforming, as the word says, it is referring to a dramatically changing landscape, whether it is in form or in appearance, or it could mean inducing or is spontaneously changing. It could mean drastic change that one would be into or would introduce. Then the word health. As WHO defines it, it is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. It's a state that allows the individual to adequately cope with all demands of his daily life. Evidence-based research, because it means that the information used to make decisions about patient care should always be based on sound research and not just on an opinion or from a mere opinion. This means that one must search several sources, published articles in medical journals or in electronic form for data, results, and conclusions of valid, reputable studies. And what is evidence-based practice? Why is it important? Why would we consider this practice important? Evidence-based practice provides the most effective care that is available with the aim of improving patient outcomes. So patients expect to receive the most effective care based on the best available evidence. And evidence-based practice should be made the norm in every health professional's delivery of his services, and more specifically of the pharmacist services in as we all have to work collectively. And what steps can the pharmacist take to advance transformation of global health? There are three suggested recommendations. And these are: one, to identify the transformation needs. It is important that we know what we want, what we do should look like, and then commit to the transformation. It should not just be that I wanted to do this is how this has to be done, and then I start doing it at nagniningas pugon, hindi naman already encountered in the process or in the journey that it takes during the transformation. So what steps then that the pharmacist would do, which are very important for her to be guided by a goal, as mentioned in the earlier slide. We need to have the purpose because we need to move to how we would want health service delivery should happen. Now, healthcare transformation, as you and I know, needs healthcare, health rather, transformation needs healthcare transformation. So we need to take some effort to reorient the entire delivery system is or is the patient. We need to know who our patient is, what the needs of our patients are. So in healthcare transformation, it is important that we understand the user, the recipient of our services, what his or her needs are. As we know, you and I know that as we do this, we have to be always reminded that there are goals that we need to achieve. There are objectives that we need to deliver or we need to attain. Servicing patient always has to be anchored on what outcome, which I find very important for every health professional to know and to understand, especially the pharmacist. Number one is prevention of premature death and disability. This is very important. And two, it's maintenance and enhancement of the patient's quality of life or the person's quality of life. And third is his personal growth and development. And fourth, which I like to share to you, is for the patient or the person to experience good death. Good death at that. And the transformation goals, in the transformation goals, what contribution can the pharmacist have or give? He could very well contribute to the attainment of the healthcare goals through one, improve access to medicines. He's very good agent in lowering cost of medication. He could always advance what is most effective, yet cost effective. And another is for him to make sure the availability of the medicines to the user or to the patient. So he has to advance or he has to promote efficient pharmaceutical supply chain management. Then the second is for the pharmacist to address the gaps in the use of medicines to prevent abuse, misuse, and irrational use. So these are very important that the pharmacist has to address. And pharmacists transforming global health in the process empower patients through counseling. He enables patients to use their medications correctly. He enables the patient to use it right so that optimum outcomes could be experienced by him. And it is important that the pharmacist is capable of collaborating with the other members of the healthcare team, with the other healthcare professionals. And to both the patients and his peers in the healthcare team or the other members of the healthcare team, he must be there readily available to provide drug information and promote rational use of medicine, including rational prescribing and rational dispensing. The pharmacist has to support patient compliance of the dosage regimen. This is very important as complications of a medical condition is for a number of times brought about by the patient's non-compliance and non-adherence to a dosage regimen of a medication prescribed to them. And the pharmacist at all times also should ensure quality of the medicines that are made available to the patient by ensuring proper storage of this and the efficient and proper handling and distribution of these medicines. In doing all of this, the pharmacist should always be anchored on published and promulgated guidelines, medical journals, and other accepted literature. So he has to disseminate information which had been validated by researches done and had been published, accepted for publication because of some evidence gathered in the process. Expected outcomes in the transformation journey that the pharmacist could take part of is one, to reduce healthcare costs. This is very important because being sick now, getting sick now is very expensive. So one highest contributor to the expenditure that one would incur when he gets sick are the medicines. So the pharmacist can play a very vital role here. Then second is minimize disease burden. And third is to lessen the crowd in the health system. When I say lessen the crowd in the health system, it's basically strengthening pharmacists who are in the front line, their skills in primary health care. So unnecessary hospitalizations could be prevented. So who should be there entering admissions to the hospitals are patients who really would need institutional hospital care and not just because there is something felt not better in my system, which could have been just managed by a simple management process that could be very much helped or that could be helped by a pharmacist. All of these are done to ensure improved healthcare services happens and better quality of life years of the patients would happen as well. Now, studies have shown that studies have shown that only when the pharmacist had been accepted as a vital member of the healthcare team can the necessary supporting services be organized with a professionalism that health professionals and patients demand. And in highly industrialized countries, acceptance of the need of professionalism in the supply and dispensing of drugs and healthcare appliances has long been seen indispensable because of the complexity of modern healthcare technology. In effect, in these countries, in these places, when we say professionalism in the supply and dispensing of drugs, pharmacist has to be there, who is the steward of these products called medicines. So these are not allowed to just be done by anybody because the nature of this product called medicines is to be known well by the person handling and making this available to the user. Pharmacists are uniquely qualified to do all that I have said earlier. He is very well qualified to do it, given that he understands the principles of quality assurance as they apply to medicines. So he knows this very well. And second, he could appreciate the intricacies of the distribution chain. He knows the intricacies of the distribution chain and the principles of efficient stock keeping and stock turnover. The pharmacist knows this very well. He knows how storage requirement for its kind of medicines is. He knows what particular temperature would the stability of the medicines be sustained or ensured or protected. And he knows when damage could happen because of humidity and temperature, which go beyond what is required for storage of a particular pharmaceutical preparation. And pharmacists are familiar with the pricing structures applied to medicinal products within the markets in which they operate. He understands how pricing is being determined for each type of medicine preparation, and he knows that for one particular molecule, there could be prices which are too high, and another one in the middle, and another one in the lower level. But all of them passing all the so-called equivalency requirement as a standard in testing efficacy and safety or efficacy of the product is assured. So, kumbaga, alam ni pharmacist na may isang mas murang gamot na kasing bisa naman sa mas mahal kasi the gamot has complied with the equivalency standard test requirement of the regulatory agency. Kaya alam niya kung anong pwedeng gamitin na alternative or equivalent. And pharmacists are custodians of the technical information on products available in the market. Alam na alam ni pharmacist kung anong dapat maintindihan sa isang gamot, given that he understands very well the nature of these products, having had studied everything about this preparation with how they are structured and and what would happen to them when we enter a system or a body of an individual. And pharmacists are able to provide informed advice to patients with minor ailments and often to those patients with chronic conditions who are on maintenance therapy. Alam niya kung paano ang symptomatic treatment that could be rationally given and responsibly given to a patient. At alam niya na yung reklamo or yung kondisyon na inireklamo ng pasyente would require some medical attention already. So he or she could very well determine that. And also, he understands how chronic patients have to be guided adhering to the maintenance therapy that are prescribed to them. Pharmacists also provide an interface between the duties of prescribing and dispensing medicines. And in so doing, they dispose any perceived or potential conflict of interest between these two functions. So in all of this that I have discussed and mentioned, this is actually done by pharmacists as he delivers patient counseling services. That patient counseling in a pharmacy work assumes very prominent importance. Hindi pwede yung may nangangailangan ng gamot at binibigyan ni pharmaceutica at pagkatapos magbayad, yun na. So, importante na ang tamang informasyon maibigay sa pasyente, sumagamit siya ng tama. Kasi walang magaling na medisina na magbigay ng magandang epekto or magandang outcome sa isang gumagamit kung ang medisina ay hindi nagagamit na tama. So it's very important that rational, responsible use of these products called medicines should happen. And the person responsible to allow that to happen is the pharmacist. So we have to let go of the days na si pharmacist ay nagtitinda ng gamot lang. This is what the world expect us to do. This is what the world is looking at how pharmacists could help them when they are using medication, when patients or people are using medications. Now, as the pharmacist gives or delivers patient counseling, she has to all the time remember the essential components of health, which should be included as he communicates and discuss things with a patient or a medicine user. And this include nutrition. Kailangang i-advise ng isang pasyenteng gumagamit ng gamot, anong dapat at hindi dapat gawin, relative to the food, relative to the intake of things that they do day to day. And then hygiene, he has to remind also the patient on practicing personal hygiene, on making it sure that all the time the surroundings is clean, pollution-free environment should happen. Proper sewage system and garbage disposal also has to be included, especially with the excess of the medication. Patients should be already advised as we move towards the better normal of this life that disposal of unused medication, of excess medication should not be treated like how they are disposing any ordinary garbage or trash. Hygiene, as we all know, is most important aspect of infection prevention and control. It is very important to prevent the spread of communicable and infectious diseases. And another that has to be included in the pharmacist's advice to patients is how that their habits are relative to the kind of lifestyle that they are having. So it is important that we will be able to advise them to do some physical activities, to do some fitness activities, to shy away from any unhygienic practices like spitting anywhere, sneezing without covering the nose and the mouth, coughing without covering the mouth, littering, throwing trash just anywhere. So these are things that we have to also teach them. We need to always remember that our waste also contributes a lot to unnecessary medical conditions happening in the population or in residents of a certain country. So transforming health then is possible through transforming healthcare, and very essential in the transformation process that you and I should always remember, that we all has to remember, is one, professionalism. We have to always observe professionalism as we introduce changes, as we advance certain changes, especially as we move to transform how the health of the community should be. Then accountability and utilization of information technology. Especially at this point in time, technology plays a very important role in the way we do things, in the way we are being informed and we service people. Transformation of health or transforming of health is done because we all would want to see that everyone gets better, and we will be able to achieve this through innovative integration of thoughts and ideas so that we could prepare and devise a better plan in how we could protect health of everyone. And transforming health, as I have mentioned in my discussion earlier, involves proper use of medicines. Medicines being products that play pivotal role in transforming health. And since we're talking of medicines, of course, we cannot separate the pharmacist from it. The pharmacist occupies central stage in the process in making quality medicines available for safe, effective, and economic therapy. Pharmacists can efficiently integrate professionalism, accountability, and IT for the benefit of the patients and the health system as a whole. So pharmacists in transforming health can definitely reduce healthcare costs. He could decrease disease burden and also could improve crowd in the health system, all for the purpose of improving therapeutic outcomes. As a pharmacist involved in transforming health, it is important, and this is a reminder that I would like everyone to remember, that we have to all the time stay calm, but adopt boldly. We have to constantly update ourselves and observe speed and precision. We have to always act with urgency, yet with accuracy. Deliver services reliably, deliver our products reliably, and we should not justify actions that we do. Instead, we have to focus on solving problems. Then engage ourselves for impact. We need to communicate all the time with transparency. This is very important for the pharmacists. Now, in the process, in the journey of doing some transformation, the pharmacist encounters challenges. But always I would advise my fellow pharmacists and everyone listening to us now, viewing with us in this activity, to take challenges as opportunities in disguise. More than ever, fellow pharmacists, today the need for pharmacy services is greater than before. And transformation from a brick and mortar to digital platform of pharmacy operations equates to workforce and transformation. In effect, when I say it equates to workforce transformation, it means it requires a change in us. It requires a transformation from within. So in the process, it requires careful needs assessment. What do I need to change so that I could address the needs of my patients, which I am also encouraging to change? Prioritization, to all the time have evidence-based action plans that are tailored fit to where you are, to the country that you are practicing. In conclusion, I would say that transforming global health lies in the provision of awareness regarding nutrition, hygiene, habits, activities, rational use of medicines, complete eradication of medication errors. This might be very, very ambitious, but we can do this because if we talk of medication errors, these are preventable events. So I would be justified when I say completely eradicate it and rigorous patient compliance. I'm trying to explain that because for people who may be listening to me now, they might look at me as very ambitious with the intention of completely eradicating medication error. Kaya ba ito? I would always say, yes, kaya, if all of us in the healthcare team works in collaboration with each other. Because after all of us are working for one and the same service recipient of ours, and that is the patient. I will reiterate and repeat, medication errors are preventable events, meaning if we do our share of the work, it will not happen. If these are properly inculcated in life, transformation of global health will become a reality, and prosperity will no longer be a distant dream. So pharmacists, anchored on published evidence-based article or doing evidence-based practice, all that we need to do is to be bold, passionate, and committed to the work that we have taken oath of and we have pledged to do, give our clients. And we also at the same time have other healthcare managers and workers who are as bold, passionate, and committed as we are. And I would just like, before I would end, to share this beautiful message from Atol Gawande. Atul Gawande is a surgeon. He is a medical surgeon and a public health researcher who worked as a CEO of the healthcare venture haven of Amazon. And he said, providing healthcare is like building a house. The task requires experts, equipment and materials, and a huge amount of coordination. And I love the statement, and end of quote. He said it very well. And as we all in this pandemic that have and will continue to change the way we do things, allow me to close my sharing with this personal message. Maybe one of these days, one day in the future, when social distancing becomes a thing in the past, let us hug a little more, embrace a little tighter, hold a little longer, and remember that nothing matters more than the time we spend and the care that we give to the people that we serve. And this should be the kind of mindset that the pharmacist will have. I'm very passionate of telling our pharmacists that our work is not just there because we need to earn a living. We are there to also serve, and in the process of service, we earn what we need also for our personal needs. So with this, again, I would say thank you. Happy Pharmacist, World Pharmacist Day, and be one of us. Be with all of us in transforming global health. Pharmacists can do a lot. Pharmacists can be there to be more and do more for the public that he or she serves. Again, thank you.
Thank you so much, Ma'am Leonie. Indeed, pharmacists should be involved in transforming global health, and we should be more proactive in providing awareness regarding nutrition, hygiene, habits, activities, rational use of medicine to completely eradicate medication errors and to help our patients. So now let's proceed with the question and answer. I've been receiving questions, but I love to start the question with this. I think to the both of the speakers, here is the first question. Question is, as a student pharmacist and leaders, how can we be more proactive and also how can we be involved really in the organization to help transforming global health in our own ways? Let's start with our first speaker, Mr. Paul Anthony Balbero.
Ayan. Hello, good afternoon, everyone.
Good afternoon, sir.
Hello, Dean Harvey. For that question, I think in the simplest way that students can do, since most of the time they are doing online classes and most of the time they are having their cell phones with them, maybe
Yes.
with just a simple sharing of medical informations that they have learned from their schools, not from their researches. I think it's one simple way of reaching out to people who are in need. Just like what I have researched on, there are three benefits of using social media in terms of provision of healthcare. First one is spreading the right news, since even if you're just students now, kahit hindi pa pharmacist, since na from our first year up to our fourth year of studying, we are already bombarded with lots of correct information. We can thoroughly share them in our social media pages. Sabi na kanina, we just use the correct hashtags, because hashtags are phrases that we can use to reach out to more audiences that we want to reach out to. And another thing is social media is very important in terms of providing mass information. Mass information in terms of instead of health professionals giving informations one by one to patients, you can just post a poster or educational video. As long as you validate the information that you give, as long as those informations are, sabi nga po ni Ma'am Leonie, are from evidence-based sources, I think those are things that we can do in order to foster this better transformation of healthcare provision using the social media and the internet.
Thank you.
Okay, thank you, Sir Paul. Now let's proceed with our next speaker, Ma'am Leonila.
Harvey, can you hear me?
Yes,
Can I
ma'am.
okay. I have one in my slide that mentioned that one has to be bold. So in order to be involved, you really have to be bold. Hindi dapat mahihiya. And kung pwedeng mag-volunteer, because this is one thing that would allow those who are already in practice to know that there's somebody who has the potential. I will share what I have done to some people who are now holding very good positions in their respective work, who are in fact serving as consultants in big and popular companies, and in fact, including you, Dean Harvey. These pharmacists that are not working in big companies and are holding very good positions used to be my student volunteers. So I was an officer of the PPHA, and especially when I became a president, marami akong mga estudyanteng volunteer na tumutulong. So I was bringing in the young to come in, to be involved in the organization. So they were assisting me in some of the researches that I did. So they became my research assistants. So and in the process, they learned what are the things that has to be done. And of course, I also have to expose them to what they need to know more. And now they are there holding very good positions. And they are, in fact, many of them are already serving as consultants, even doing better than I do, than I am. So, hindi naman, minsan nga, natatanong ako, ma'am, hindi ka ba natatakot na yung mga tao tinuturuan mo at sila ay lumalabas na na-advance pa and whatever would be the thing that will happen? My answer is simple. If the people I teach would do better than me, then I must be a good teacher. I must be a good mentor. So I would be very happy. If there is anyone who would be happy to see people that he trains to be doing good, then ako yon. So, huwag matakot, huwag mahiya, mag-volunteer kung pwede. Minsan nga, nung una, natatakot kaming lumapit sa iyo, ma'am, kasi you appear to be that strict as a person, parang suplada. Pero may mga impression kasi na minsan mali tayo eh. So there's nothing wrong in trying. So again, be bold, advance, and volunteer. Present yourself because there is always something that we can contribute. Thank you, Harvey.
Thank you, Ma'am Leonie. And here's another question again to the both of the speakers po. The question is, what are the challenges that we might encounter, especially being involved in the organization transforming global health or transforming the pharmacy profession? What are the challenges that we might encounter, and what are the character that we need to have to ensure that we'll be able to overcome these challenges? Thank you. We'll start again with our first speaker, Sir Paul.
Siguro po in terms of the challenges that us health professionals are facing during these times of trials that we have, siguro firstly is yung yung lack of the heart to initiate, since everything is being done online, everything is being done in the closets of your home. Kumbaga parang nawawala po yung part na we do this in front of the patient, we do this in front of our customers. So siguro the biggest challenge is how you do it, how you reach other people, more people in an online platform, and how you do it in a way na they will still believe in you. Di ba kasi po, we have a notion that everything that we see online, we cannot see it as something reliable. So maybe the challenge is for us pharmacists to make our profession and our title more evident and more appealing to people, lalo na if we are doing online consultations, online using online platforms. And since in the Philippines, di ba, we all know that the profession is not yet that much ennobled because of also maybe some things that we lack and some things that we do. Siguro yun po, the challenge is on how you make people believe more in you, believe in our capabilities and our skills as a very important part of the medical profession. Yun po. Siguro yung term is yung credibility, how we enhance the credibility using the online platform. So yun po.
Thank you, Sir Paul. And now, let's hear it from Ma'am Leonie.
Okay, challenges. Talagang marami. When you want to push on something, when you want to introduce change, if you would be part of a transformation team, talagang maraming challenges yan na makikita. And what important challenge that one has always to be prepared of is meron parating obstacles, meron parating tao na hindi ka maiintindihan doon sa gagawin mo. There will always be people who could be against you, even if your intention is good, even if your intention is for the better of the majority. But my advice to this is always to take that attitude that you cannot please everybody. For as long as you are clear with your direction, you are clear with your purpose, and you know how to go where you want to go, and alam mo that you're within the legal requirements of the practice of the profession, the legal requirements as we do things in this life, dapat hindi matatakot. So ang importante is when you encounter situation like this, work with a few who believes in you, who believes with the purpose that you set, and take those few as your champions, so that with this little few, with this few, you can move forward and you can work and proceed. Kasi pag nagpapa-apekto ka doon sa konti na kukontra sa'yo,
Wala ka talagang mapapatunguhan. And then, another challenge is still that situation that we are not very well recognized and acknowledged yet as one significant player in the healthcare team. So we have to show our value so that these people would know how valuable we are and what contributions we can give. As I had enumerated earlier, marami pong pwedeng gawin si pharmacist. Pwede siyang mag-multitasking kasi ang lawak ng kanyang training, ang lawak ng kanyang education. And then what kind of character should you possess in order to do this? You have to be proactive, you have to be positive, practice resiliency, and be always humble. Sometimes naiinsulto ka, isipin mo na lang na mas alam mo kaysa doon sa taong nanginginsulto sa'yo. So if that person could not understand at that particular moment, then take the time to understand because you know more than that other person. So this should be the kind of attitude kasi masisira ang beauty at ang kagwapuhan mo pag nagpapaapekto ka sa mga taong kukontra at negative sa'yo. Basta importante, be clear with your purpose. That's why I said in the transformation process, 3 important recommendations is know what you want to do. Know the kind of change that you want to introduce. So identify the objective. Yun lang. So simple, very simple. Be positive, retain that humility, be proactive, and other things. But maintain your integrity. Yun ang pinaka-importante. Kasi that is one asset a person should have 100%. It's an all or nothing concept. If you have only 99% of it, then you don't have integrity because there's 1% lacking.
Thank you so much, Ma'am Leonie. And again, Sir Paul, thank you so much for that very inspiring words. And now let's proceed with the awarding of certificates.
Thank you pala, Sir Paul.
Thank you po, Ma'am Leonie.
Because the online platform is one medium also, Dean Harvey, para kung may gusto kang gawin, you start, kung wala ka pang malapitan, start putting it in there and somebody could detect you. There is one pharmacist who became our speaker, which I saw just in the blog, in the post that she did, and I called her up. She had very good ideas, so she came in to be already now in the team working also for the advocacy to advance the profession.
Yes, thank you so much once again, Ma'am Leonie, for that very inspiring word, and Sir Paul. So let me read the citation of the certificate. The Philippine Women's University, the first university for women in Asia founded by Asians, and the School of Pharmacy FJC PPHA ETA chapter, hereby awards this certificate of appreciation to Ma'am Leonila M. Ocampo, RPHMS, for being the guest speaker during the World Pharmacist Day 2020 and Clara Aragon Memorial Day with the theme PhilWomenian Future Pharmacist, Catalyst in Transforming Global Health, given this 28th of September 2020. Signed by Mr. Roland Emil Peñalosa, Advisor of FJC PPHA ETA chapter, and yours truly, Mr. Mark Harvey Adamson, the Program Chair of the School of Pharmacy.
Thank you very much, Dean Harvey.
Thank you so much po, Ma'am Leonie. And now for our second speaker, again, the Philippine Women's University, the first university for women in Asia founded by Asian and the School of Pharmacy, FJC ETA chapter, hereby award this certificate of appreciation to Paul Anthony Balbero, RPH AQID MS, for being the guest speaker during the World Pharmacist Day 2020 and Clara Aragon Day with the theme PhilWomenian Future Pharmacist, Catalyst in Transforming Global Health, given this 28th day of September 2020, signed by Mr. Roland Emil Peñalosa and yours truly, Mr. Mark Harvey Adamson. Once again, thank you so much to our
Dean,
guest
thank you.
speakers. Thank you for giving us your time. And now, before I end this webinar, let's sing the Philippine Women's University hymn. Again, thank you so much to all the attendees, to all who attended this webinar. And again, I would like to leave this message. Happy World Pharmacist Day, and to all the courageous pharmacists out there who continuously uplift the pharmacy profession and serve us as our frontliners in all pharmaceutical fields as we continue to face this pandemic. You are an inspiration to all of us. And to all the promising student pharmacists, may you continue to pursue and excel. Padayon Future Pharmacist. And again, I am Mark Harvey Adamson. Thank you so much and God bless.